Well, as the number of coronavirus cases across the globe continues to rise, it's 182,000 at the moment. People are being encouraged to employ what's called social distancing. Now, it's working from home or remaining at a safe distance from those around you, and these are all the measures they want us to use. I don't know about you, I think I'll probably use a bit of an explainer on social isolation versus social distancing, and I'm a bit perturbed about this new rule that's likely to hit nightclubs and bars, because I can't see at the bar or on the dance floor that distance will be kept. But anyway, we'll talk to an expert. Joining me now, Professor Robert Booy, Head of Clinical Research at the National Centre for Immunisation Research and Surveillance. He joins me now on the phone. Robert, thank you so much. I really appreciate your time. We're so, well, we're all getting our heads around all of this, virology and disease preparedness. Give me a simple explanation between self-isolation, I take that staying at home, and distancing ourselves, social distancing.
Yes, self-isolation. My wife keeps telling me to get this better explained, so I'm glad you asked. If you're at home and you don't go out, unless it's an absolutely essential thing, you also isolate yourself from people at home as well if you have symptoms that suggest corona. So that isolation can be mixing with people if you've got no symptoms, but if you have, you use a separate bathroom, a separate bedroom, but have ventilation opening the windows. You eat separately, and you do all you can to not infect other people in the house. So wash your hands and the usual measures. Now, social distancing is all about lessening the risk of one person giving the infection to another. So when they say at least 1.5 meters, that's about the distance when someone sneezes or coughs, that a droplet can come out and then land within about 1 metre or just over 1 metre of the sick person.
All right.
So if you're away from that, you can miss out on getting infected.
All right, I think I've got a nice little bit of vision there of Prince Charles. He took it with a bit of grace the other day, turning up to a function in Britain, practising his social distancing. He didn't shake hands, a bit of a smile on his face. We'll play that for everyone. There he is now, getting out, putting his hands up. I think he was putting his palms together like he was saying a prayer. He was trying to be polite, but he says he finds it very awkward. I mean, one of the concerns you have, you just mentioned how you can self-isolate at home. If someone in the family has it and someone else doesn't or doesn't at this stage, if you're sharing a bathroom and sharing a kitchen, how on earth can you keep distant? Aren't you going to have to assume if one person's got it, the rest of the household will?
No, the risk when one person is infected and a second one getting it is actually well under 10%, and that's from very good work done in China. So you can make a difference. The frequent hand washing and the other measures, not touching each other, but keeping that distance even at home, can make a real difference.
Oh, that's good. That's positive. Give me a bit of a sense. Probably start at the beginning. I mean, how does a vaccine get developed, and how quickly, in general terms, can we get it to market? And then where are we up to? I know there's a lot of global organisations and some in Australia working on a vaccine for coronavirus. Where are we up to? Because there's reports overnight in Seattle, some early trials are underway.
That's right. The United States is first off the mark. We're not close. We're not very far behind. Up at the University of Queensland, they've done work on a potential vaccine that's going into animals and could soon go into humans for safety studies and also for immunogenicity, a big long word that simply means we measure in the blood the antibodies that can kill the virus if the vaccine has worked. So in University of Melbourne, only today they've announced that they've measured in the blood of people who've had coronavirus, 4 or 5 patients, that they do make antibodies and they do fight off the infection and recover. And it's a bit like the flu. They're similar kind of viruses in the sense that both stimulate our immune system and they can mutate easily and change their spots, so we have to keep ahead of that. But we know now that we can make a vaccine which will protect. How long it will take? Look, if we're really lucky and the science goes fantastically well, 6 or 9 months. But the truth is that most scientists are saying, I'm a bit of an optimist, most scientists are saying 12 months at least. In the past, it's taken us 10 years to make a vaccine. We had 20 years ago SARS. We never could make a vaccine for that. We had 7 years ago MERS, we've just got to a point where we had a vaccine that looked like it might work. And we're building on the MERS work, because it's a coronavirus too, to make a coronavirus vaccine against COVID-19. So we're making real strides forward, but it will take months.
Professor Booy, do we know yet whether you can get it twice or multiple times?
Look, any viral infection, we know most people recover, and they recover with immunity, at least 95% in the main. So there is always a few percent who, for some reason, don't make a good protective response that lasts for years. And so there is a possibility, and we'd have to accept that possibility of people getting it a second time. I don't think they'll get it a second time within days or weeks or months. They might get it some years later when their immunity is weakened, or if they've got immunosuppression from steroids or cancer, that too could make them at risk a second time.
Right, well, you're a real expert in this area in a way that I am not. If you had older people in your life, what would you be advising them to do? And if you're fit and healthy, how would you advise my viewers to interact with older Australians?
I think it's really important to care about our older Australians. I think my wife's just returned today from 2 weeks with a 95-year-old father. It's really important to spend time with them. First-degree relatives in nursing homes or in independent living should feel free to visit, wash their hands, keep the distance, but have the smiles and the conversations and all that. In nursing homes, you don't need non-essential visitors. That's one way to do the social distancing. Only expose people to those that are close to them that they love and that are not symptomatic. You don't go and expose yourself with symptoms to an older person or to a person with immunosuppression.
Would you say to older Australians watching tonight, anyone over the age of, let's say, 70, would you recommend they try and stay at home where possible? All of us are doing this, not only people over 70. And some good news, again, that I read today from New South Wales Health, that the flu rate, instead of going up, which it starts to do at this time of the year, it's actually gone down a bit. Now, that might be because we are practicing social distancing. It just might. And what's more, vaccines are available. So, older people should be getting their flu vaccine as soon as the free one is available in a couple of weeks. But for younger people who might expose themselves to older people, who might, go and visit an older person, you can go to the pharmacy right now and get a vaccine and reduce your risk of catching flu and visit with your relatives more safely. Well, just before you go, I want to put up on the screen a lovely little letter that was sent to some schoolgirls, St Margaret's Anglican Girls' School. It's a school in Queensland. These young girls did a bit of a fundraiser. They wrote to the University of Queensland's Medical Centre, who are working on the coronavirus vaccine. They had a fundraiser at the school. The girls raised $100, and they wanted to, grade 5, I might add, grade 5 girls, and wanted to send it off to support. And look, all credit to Professor Paul Young, who heads up the research team on coronavirus. He wrote a really lovely letter back to these schoolgirls that thanked them for their philanthropy and their fundraising money. So that's lovely to know. In all of the bad news we seem to be running at night, yeah, I know, isn't it? It's really lovely to get some good news.
Paul's an amazing guy. I've known him for 30 years. He's a tremendous scientist and he's making huge advances.
Well, terrific. And I really appreciate your time tonight, Robert. Thank you very much.